Flu season is upon us, and today I'm going to take you inside a pharmacy to show you the 3 items you must buy if you or your child has a cold, the flu, or that pesky wintertime bronchitis.
I got bronchitis. Ain't nobody got time for that.
If you're new to the channel and have never seen me before, I am a practicing board-certified medical doctor who is approaching 60,000 patients treated. And as much as I hate when people go to the internet to get their medical advice, if you're going to get it from somewhere, I'd like to think I know a few things. My goal in this video is to help you better manage your upper respiratory infection while dispelling some of the common myths I hear all around the healthcare environment. For example, I woke up sick this morning and I want to go ahead and get on some antibiotics so it doesn't turn into pneumonia. Or that first antibiotic didn't really do the trick, I'm still sick, I need something stronger. Or I've been sick for 4 or 5 days now, I just can't kick it and now I need an antibiotic because I think that's what I need to get better. And while that last line of thinking is the most reasonable compared to the other two, it's just as wrong, and in the video I'll tell you why. But to start off, let's talk about the first thing you need to buy when you're at the pharmacy, and those are a class of medicines called antipyretics.
Wait, what did he just say?
Antipyretics, which is a very nerdy and medical way of saying medicines that lower your fever. Now, there is literature out there that says not treating the fever may be the better way to go, and if you're an adult and you have a low-grade fever and you want to let it ride, sure, that's fine.
Knock yourself out.
But especially in children, I haven't seen any compelling evidence that says treating a fever is the wrong thing to do, and it will be a long time before you convince me otherwise for several reasons. Mainly, when a child's fever is high, they feel miserable. They don't want to eat, they don't want to drink. If you can lower their fever with Tylenol and ibuprofen, they may not feel like their normal selves, but they will feel a little bit better. They are more likely to continue drinking and not get dehydrated. It solves several problems. But there is a very common mistake when it comes to over-the-counter fever reducers that I see almost every new parent make. These children's medicines are weight-based, and when you look on the instructions, you will see that they will give the same dosage for an 11-pound swing in weight. Now, 11 pounds may not seem like a lot, but for Tylenol, the dosage is 15 milligrams per kilogram.
Math.
Now, an 11-pound swing, 11 pounds is roughly 5 kilograms, 15 times 5 is 75 milligrams. You are potentially underdosing your child's Tylenol by 75 milligrams. And if you underdose the medicine, it's not going to work. And that leads to a false sense of fear for parents who think that the over-the-counter Tylenol and ibuprofen isn't lowering their fever, giving them the idea that their child potentially is sicker than they actually are. Now, because I don't want med-mal lawyers to come after me, I'm not going to get into the intricacies of dosing on this video. But the best thing I recommend for you to do is buy the medicine, call your pediatrician, tell them how much your child weighs, and they will give you the exact dosage to give your child, and I almost guarantee you it's going to be higher than what's listed on the bottle. Before we talk about the second thing you need to buy at your pharmacy, let's talk about how long you can expect to be sick. Most of the general population think that average illness should last anywhere from 3 to 7 days, and people start getting a little bit concerned when they hit that 5-day mark and still feel unwell, and that's generally when a lot of people start looking for some pharmacological assistance to get over their illness. This study that I'm showing you here looked at 22,000 patients. They found that after looking at over 20,000 patients, in 90% of the children, it took about 7 to 8 days for the earache to resolve. For a sore throat, it was anywhere from 2 to 7 days, bronchiolitis by 21 days, and an acute cough. And this is an important one because just about every virus in the wintertime causes a cough, and everyone really starts to get ticked off when the cough is still bothering her on day 5, 6, 7, 8, 9, 10. Looking at this data, the average duration of a cough during the wintertime is 25 days, nearly a month.
That's a long time.
And if you think about it, deep down you know it's true. Everybody at some point in their life has suffered from a cough that just lingers for weeks. And most people have been on numerous rounds of antibiotics. It doesn't want to go away. They go back for additional antibiotics, and it finally goes away by the 3-week mark, and they think it was the second antibiotic that did the trick when it was generally a virus all along, and it was just lasting the duration that it was going to last regardless of the medicine that you took. So that gets back to that second myth that I was talking about earlier. I've been on an antibiotic for a week now, I still have my cough, I need a second antibiotic, something a little bit stronger because the first one's not doing the job. The first one technically didn't fail. It didn't fail because it was never going to work in the first place. These viral coughs are just going to last, and they're going to last for what feels like forever. And what's interesting is a lot of the children that were included in the study, a lot of them did receive antibiotics. And the authors note, while symptomatic treatments might reduce symptom severity, they are unlikely to influence the overall duration of the illness. Most people, as soon as they have a sore throat, they want antibiotics because they think it's strep throat and they know that's going to make them better.
I just need some antibiotics.
And I get it. It's generally a decent line of thinking. People want to take antibiotics for strep throat because they think it's going to cure the illness. It actually doesn't. The only reason healthcare providers give antibiotics for strep throat is to prevent the complications of strep throat, namely rheumatic fever. Ask your grandmother. She knows about rheumatic fever because she probably had it, or she definitely knew somebody who had it way back when. There are other complications that we want to avoid with the antibiotics, like abscesses in the throat and potential ear infections. But the point that everybody should know is antibiotics are not going to significantly shorten the duration of your sore throat, regardless of whether it's caused by a virus or a bacteria like streptococcus. And every parent who is not told this and takes their child on day 2 or 3 of the illness and gets started on antibiotics always returns to the office on days 4, 5, and 6 saying their child still has a sore throat and they want something stronger. It takes a long time for the symptoms to go away, regardless of antibiotics or not. So if you can continue taking Tylenol and ibuprofen for the pain, maybe some honey sticks to line your throat, continue drinking so you don't get dehydrated, you will get better. But just know, regardless of when you start your antibiotics, from the onset of your symptoms, you are going to feel unwell for at least about 7 days.
Now I feel better.
Okay, the second thing you're going to want to buy here at the pharmacy is some sort of over-the-counter multi-symptom relief medication. Some form of decongestant, some form of cough suppressant. For pediatric patients, my favorite was always Children's Triaminic once they're over 4 years of age. Before you follow any of this advice, if you choose to do so, definitely consult with your medical doctor, because if you have liver problems, you're not going to want to take Tylenol. If you have kidney problems, you're going to want to avoid ibuprofen. So again, consult your medical doctor first. But what you need to realize is all of those medicines are just slightly better than placebo. I tell everybody, when you go to the pharmacy and you go down the fever aisle, you see nothing but Tylenol because it works. It lowers your fever. When you go down the cough and cold aisle, you see hundreds of products literally saying they do the exact same thing. And if one of them truly worked, if one of them was that miracle drug that actually worked, everybody would buy that one product and the entire row would look like that one product, just like the Tylenol on the fever aisle. So again, buy one. Maybe you'll be one of the lucky ones that gets a lot of relief, but just know most people only get marginal amounts of relief, and this whole process, this whole illness, all these symptoms just kind of have to run its course. The third thing you need to buy is coming up, but let's go back and dispel some of the myths. I will tell you right now that if you go to your doctor with symptoms of an upper respiratory infection and they give you a Z-Pak without doing any objective confirmatory test, they are basically telling you, I am giving you this antibiotic basically because you want it and for no other reason, and it's not going to make you better, but they don't tell you that last part. They want you to leave somewhat happy, but they know that your illness is going to get better on its own, and it's probably going to coincide with the time that you finish the antibiotic. I was told about a case a while back whose parents took their child to the emergency room. They strongly requested an antibiotic for their child's what was most likely viral respiratory infection. The doctor gave them azithromycin, or Z-Pak as it's commonly called, because that's what the parents wanted. They went home, the child started taking the antibiotic and then developed upset stomach, started vomiting, couldn't stop vomiting, came back to the hospital severely dehydrated and was admitted for intravenous fluids. That entire second visit and admission to the hospital is entirely unnecessary and should have never happened, and all they had to do was not give antibiotics. As a quick aside, if you go to your doctor and they give you antibiotics to take, I am not saying do not take them at all. I am definitely not saying that. Follow the recommendations from your primary care doctor. I'm just saying if they say it's most likely a virus and let's give this a few more days, or here's your antibiotic, take it home but don't start it yet, let's give it a few more days, that is probably the most reasonable way to approach things. Most people need to realize these illnesses are going to last way beyond 7 days. I mean, the data says that. But getting back to that first myth, today is day 1 or day 2, I feel terrible, I want to get on an antibiotic before it turns into pneumonia or something really bad. It just doesn't work like that. If you go requesting an antibiotic before you truly need one, who knows what kind of antibiotic you need? That's like going to the gas station and not looking at which handle you choose before you put it into the car. You might get the right one. You're statistically speaking going to pick the wrong one. And if you actually get diesel, you're going to jack your car up. Some of these antibiotics, like it did for that pediatric patient that I mentioned earlier, potentially can jack up the body and make things way worse. Again, I'm not saying don't take antibiotics. I'm just saying if your doctor says give it a few more days, it's probably reasonable. And if you do develop a more sinister bacterial infection, at that moment, it's a lot easier to figure out what's the antibiotic that's actually going to make you better. Okay, the third thing you need to buy at the local pharmacy is a calendar. Obviously, I'm being kind of silly because you can definitely use your phone, but what you need to do the first day that you develop any symptoms of being sick is mark that day on the calendar and then count forward 14 days and think to yourself, this is probably the day I'm going to get better. Now, between days 0 and 14, I am definitely not not saying seek medical advice. I'm just saying if you go to the doctor and they say your history and physical exam is most consistent with a viral illness, I would recommend giving it at least until day 14 until you really get concerned. Take the fever reducers like I said, take the symptom relief like I said, continue to drink plenty of fluids and stay hydrated, but don't put your faith in antibiotics. That's my 2 cents on the matter. If you disagree or have a different patient experience, put it in the comments below. I will do my best to respond to it, and I hope you have a great day, everybody.